Okay, I would verify the healthcare provider's orders. I would gather the necessary equipment and supplies. I would perform hand hygiene. Okay, how many was JC? I'll be your nurse today. Can you tell me your name?
Jordan.
And your date of birth?
3/25/96.
Okay, all information matches with his hospital bracelet. Today we're going to be giving you a complete bed bath. So I would assess the patient's tolerance for bathing and activity and their comfort level and all their musculoskeletal function. I would assess for shortness of breath before or during the bath and assessing the condition of the patient's skin. My patient has already voided. I would apply clean gloves. Okay, and I have all of my supplies arranged, so I would raise the bed to a comfortable working height, and I would then lower the rail on my side and help the patient get into a comfortable supine position, maintaining the body alignment. The patient is more towards the side that I am working on already. So I would place the bath towel over my patient. Okay, and now I will have the patient hold the top of the bath towel and remove the top sheet from beneath without exposing the patient and place it into the soiled liniment. So we hold the top of this. Okay, and I will then place this in my soiled linens. Sorry, let me see if it's aligned right. Hopefully it stays. Okay. Okay, I would remove the patient's gown. My patient I didn't have a gown, so I'll remove the patient's gown. My patient doesn't have an IV line. And if he did, I wouldn't disconnect the IV tubing to remove the gown. Okay, now I would raise the side rails and lower the bed to a comfortable working height for the bath. My wash basin is filled 2/3 of the way with warm water. Okay, do you mind putting your fingers in here, making sure the water's okay? Okay, temperature's fine, patient agrees. Okay, now my patient does not wear contact lenses, but now I will wash the patient's face. Okay, I will make a mitt out of my washcloth. Okay, I will wash the patient's eyes with warm water. soaking any crust for 2 to 3 minutes. So washing face. I would ask the patient if they want any, I would first, then I would dry. I would gently dry the face. Ask the patient if he wants any soap for his face.
No.
Okay, no soap. Stop it. Okay. And I would ask the patient if he would like to be shaved.
No.
Okay, patient does not want to be shaved. Okay, and if I was providing eye care for an unconscious patient, I would put the eye drops in the eyes, closing the eyelids with the back of my finger. Oh, and then I would tape or place an eye patch over the eyes. And I would make sure not to tape the eyelid itself. Now washing the upper extremities, I will remove the bath towel from beneath the arm. Okay. Will you raise your arm up, please? Okay. Under the arm. Again, I would make new towel. I will wash. Maybe if I can make my net. Okay, I would support the arm. I don't know if you can see this. Sorry. You can see this, but I would support the arm, washing from distal. Which way is it actually? Hold on, I think she did it in the video. Whole arm, doing from distal to proximal. Okay, I would rinse. Get the arm wet, going from distal to proximal, and using minimal soap. I would wash the arm from distal to proximal. Okay. And then I would have my patient lift his arm as far as able, and then I would wash again. Okay. And then I would move to the other side and repeat the same steps. So now I will cover the patient back. Now I will wash the abdomen. Oh, I didn't do the upper trunk. So I'll be washing the upper trunk. Same thing, using long strokes. Go from side to side, rinsing. Then with soap, I will clean from side to side. I will rinse all soap off, and I will dry. Okay. And when bringing the bath towel down, I brought it down to his umbilicus. Now I will wash the abdomen. So place the bath towel over his chest and abdomen. Over his chest. Bath towel is above the pubic region. Actually, just need one. Okay, and I will keep the. Sorry, I guess I'll just use this one. The abdomen covered between washing and rinsing. When I'm done. So now I will I will dry the abdomen well. Dry the abdomen. And I will have my patient put on a clean pajama top. Okay, now I will wash the lower extremities. And I will expose the leg closest to me. Lift your leg, please. Making sure he's covered everywhere with the leg that I am using. And I will wash the leg using long firm strokes. And I will move from the bottom up, so ankle to knee, then knee to thigh. Okay. Okay, so I'll move from ankle to knee, washing the leg. And then after that, I will move from knee to thigh, making sure to get under as well. And I will repeat the same on the other leg. I'm washing the foot. You make sure to clean in between the toes. Clean and file the nails as needed, or look at your agency's policy. So I will clean the feet, making sure to get in between all of his toes. And there is an option of soaking the feet for 10 minutes because that can help maintain cleanliness in between the toes and in the toenails. But don't do this for patients with diabetes. It is contraindicated. And then I would raise the side rail and lower the bottom side rail and repeat this all on the other side. Okay, and I will also provide perineal care. Okay, and at this time I would cover my patient with the bath towel. And I would change my water. Now washing the back, I would take off gloves. I would put new gloves on. And again, change my water. Now we will wash the back. Okay, I will lower the side rail and help my patient assume a sideline position. Okay. Okay, I will place a towel on this side, pretending he does not have his shirt on. If fecal matter was present, I would close it and fold it in an underpad or toilet tissue and clean the area with disposable wipes. Keeping the patient draped, towel over the shoulders and over the thighs. I will wash and rinse and dry the back from the neck to the butt. Okay, cleaning the butt and anus, you would move from the front to the back. This way, making sure to get into any folds of the butt and anus and paying special attention. Then I would rinse and dry the area thoroughly. If needed, I would put an absorbent pad under the buttocks. Now I would apply body lotion. I would remove my gloves. Throw these away. And I would put lotion on patient's back and give them a massage if requested. Shirt is our new pajama top is already on. If we were doing a disposable bath, I would do all of the same steps, except I would use a cleansing pack, and I would warm that to the instructions on the back of the cleansing pack, and I would use a new towel for each limb, each area that I wash. I will allow the skin to dry for 30 seconds. Still covering the patient with the bath towel. Then I would help patient with all grooming. Check the, I'll remove the soiled linen and place it in the dirty linen bag. Not allowing this linen to come in contact with my uniform. Replace the call light, show where the call light is, show them how to use it. Get patient into a safe and comfortable position. I will place the bed in the low position and lock the bed as well with at least 2 rails up, but not more than 3. And I will dispose of all my supplies and equipment. I'll perform hand hygiene, and I will document and report my patient's response and expected or unexpected outcomes. and record the procedure, including how much the patient participated, how well they tolerated the path, and the condition of skin, and any other significant findings I might have found.